look at the drugs and the irritable bowel syndrome. And as we begin with some questions, we want to know what is the treatment for the diarrhea. So in this video, you'll find the answers to these questions and learn in detail. So to begin with, firstly, we are going to see in case of the irritable bowel syndrome, that is for the abdominal pain. So how do you treat the abdominal pain? So treating the abdominal pain, firstly, there is the antispasmodics. There is antispasmodics. So what does the antispasmodic include? This includes the dicyclomine. It includes dicyclomine. And after the antispasmodics, there is also the TCA. TCA stands for the tricyclic antidepressants. So what does this include? It includes the amitriptyline, as well as the imipramine. Then we also have the SSRI. What is this SSRI? SSRI is nothing but the selective serotonin reuptake inhibitors. So it is nothing but the citalopram. Then we look at in case of diarrhea how to handle. So next, irritable bowel syndrome can be associated with the diarrhea. So diarrhea, we have the opiate. So opiate is nothing but there is the loperamide, and there is also the 5-HT3 antagonist. So 5-HT3 antagonist is nothing but the aldosterone. So just to recap what we did, we saw the abdominal pain characteristic. So under abdominal pain, there is the antispasmodics, which includes the dicyclomine. Then we have the TCA, that is a tricyclic antidepressants. And it includes the amitriptyline as well as the imipramine. So that also includes the SSRI. This is all in abdominal pain. So that is nothing but the citalopram. Then next, if you look at the diarrhea, it includes the opiate. Opiate includes nothing but the loperamide. And then the 5-HT3 antagonist is nothing but the aldosterone. Next, we are going to continue with the, for diarrhea, we saw last it was the 5-HT3 antagonist. And next, we also have the bile acid sequestrant. So under the bile acid sequestrant, it includes the cholestyramine. So the cholestyramine resin. Then when we move on to the constipation, so we saw the diarrhea, now we look at the constipation. So what happens in case of the constipation? So in constipation, there is the laxatives. It includes the laxatives. So lactatives such as the psyllium. Lactatives such as the psyllium and the ispagula. And this is nothing but the husk. It includes the husk. And also the polyethylene glycol. The polyethylene glycol. Next, we see the chloride. So the chloride channel activator. So chloride channel activator, it includes the lubiprostone. Then when we look at the guanyl cyclase agonist, there is also something known as the guanylate cyclase agonist. So what does this include? It includes the linaclotide. So just to recap what we did, we saw in case of diarrhea, we saw the opiates. So the opiates and the 5-HT3 antagonist. So we saw their respective examples, and then we continued with the bile acid sequestrant, and that includes the cholestyramine resin. Then we saw in case of constipation, what are the headings? So it includes laxatives. Under laxatives, there is a psyllium as well as the ispagula, and also the ispagula husk and the polyethylene glycol. And then there is also the chloride channel, that is the activator. This includes nothing but the lubiprostone. And then when we look at the guanylate cyclase agonist, so this includes the linaclotide. It includes the linaclotide. Whereas a chloride channel activator, this was the lubiprostone. So now we also have another category, few more categories under the constipation. So we're going to look at that. So next heading will be the 5-HT4. The 5-HT4 agonist. And the example here is nothing but the tegaserol. This is an example. Next we'll look at the SSRI. SSRI stands for the selective serotonin reuptake inhibitor, and this includes the paroxetine. It includes the paroxetine. So just to recap what we did, we saw the constipation drugs. So under that we had the laxatives, and then the chlorine channel activators, as well as the guanyl cyclase agonist. So all this we did, and after that we are looking at the 5-HT4 agonist. That includes the tegaserol and the SSRI, that is nothing but the paroxetine. So next we'll move on to the answering our question. So the question we asked was, in case of diarrhea, how do you treat? So in case of the diarrhea, the treatment will be there are some headings such as the opiate. So under opiate there is the loperamide. And next after loperamide there comes the 5-HT3. The 5-HT3 antagonist. So this is nothing but the alocetrone. And beyond this there is also the bile acid. There is bile acid sequestrant. So what does this include? It includes the cholestyramine resin. So just to recap, we saw the diarrhea and the treatment. There are three headings, that is opiate, the 5-HT3 antagonist, as well as the bile acid sequestrant. Under the opiate it includes the loperamide, and under the 5-HT3 antagonist it includes the alocetrone. Then looking at the bile acid sequestrant, it includes the cholestyramine, that is the resin. So this was about the drugs in the irritable bowel syndrome. To learn and grow daily, please do subscribe.